The United States, sadly, for all of our healthcare advances and for all of our wealth, is ranked 55th in the world in terms of maternal mortality rates. And that is really not an acceptable place to be. Sadly, the people who are most impacted are the people who are Black or Indigenous or Latina. So when you really look at the numbers, you can see that if you're a Black mom, you're 4 times as likely as a white mom to die from maternity-related complications. If you are an Indigenous mom, you are 2 to 3 times more likely than a white mom to die. And these are statistics that we can't tolerate. And again, you know, we have the knowledge. We know that we can prevent these deaths and these complications if we act together. I think that the National Governors Association is the perfect platform for working on this, because this is not a partisan challenge. This is not an urban or a rural challenge. This is a uniform challenge across the country. And so at year end, we will produce a blueprint. And the blueprint will be available for any leaders across the country who decide that they would like to challenge the status quo and lean in and really make a difference in their states. So very excited that we can provide best practices, we can share, legislation that's been passed in different states, and generally just make resources available to those governors and their teams who might want to fix their problems in their own states. While the stories themselves are just heartbreaking, the good news is that others are hearing and awareness is growing. We know that we can move the needle, and so this is clearly one that, with the United States at 55th in the world, we need to tackle.